Again, this is our August in-service. Today we have the pleasure of having Ms. Adrena Harrison. Ms. Harrison is the Director of Education for the South Carolina HIV/AIDS Clinical Training Center. Ms. Harrison is a registered nurse and also has a Master's of Science in Nursing. And what was the last one you mentioned to me?
AIDS certified registered nurse.
AIDS certified registered nurse. Ladies and gentlemen, we actually have Adrena Harrison.
Thank you all. I guess the first thing I'd like to know is, what do you all, when you hear HIV, what do you all think?
Disease.
No thoughts?
Homosexuals and a death sentence. How's that?
Yeah. Right.
So that's pretty much, okay. Well, we can dispel all those rumors today.
Okay.
And we're used to speaking to clinical audiences, so if I get too clinical or if you all don't understand something, please stop me and let me know. And I have a lot of numbers, and I hope it's not confusing, but I just wanted to show you all what the epidemic looks like globally in the United States and in South Carolina. So this is what it looks like globally. 33.4 million people are living with HIV worldwide. And since you all work with children and adolescents, I thought it would be important to include some slides on children and adolescents. So there are 2.1 million children living with HIV worldwide. Young people 15 to 24 account for 40% of new infections. 2 million people died of AIDS in 2008. The leading cause of death worldwide and the #1 cause of death in Africa. And most new transmissions are transmitted heterosexually. And this is what it looks like in the United States. We have approximately 55,000 new cases every year. The number of people living with HIV and AIDS is 1.4 million and more than 470,000 with AIDS. And I'll go over the distinction between HIV and AIDS, because sometimes people use them interchangeably and they're really not the same thing. The number of AIDS deaths since the beginning of the epidemic, and it's 583,298. And that includes 14,000 in 2007. And if I have 2007 or 2006 statistics, those are the most recent statistics from the Centers for Disease Control.
That last bullet point, 21% of what?
21% of individuals, for instance.
Of the population?
Of the population. So, well, 21% of people who are positive. Those are the people that don't know that they're positive.
Okay, so
you
of
have
the
people.
55,000?
No, we know those are positive.
Okay.
But there are approximately 21% of individuals who are positive that don't know they're positive. And that's why we have such a problem, because people don't know their status. And what we found out is that once people find out their status, they usually practice better behavioral risk.
Okay. Does that mean that 1.4 million on the wall is 21% of that would need to be added on, or?
Yeah. Well,
Okay.
21% of that number.
No. These are people that we don't know, they don't know, that are walking around every day. And I also have some slides on recommendations for testing, because there are 21% of people who don't know that they're positive. There have been some new initiatives that have come down nationwide around testing so that people can find out their status. And these are CDC slides, and this one is reported cases of HIV infection, not AIDS, in children less than 13 years of age at diagnosis, and this is 2007. And so we can look at the number of cases. In South Carolina, we are right above Louisiana, Mississippi, Alabama, Georgia. So we have 6. that were reported in 2007. And you can see what it looks like nationwide. In Florida,
29 probably because of the size of Atlanta.
because of, I'm sorry,
In Georgia, 29, concentrated population in Atlanta.
well, really, the concentration of HIV is in the southeast. But the flow of dollars actually goes northeast or either California.
There's also a high number in the state of Florida too.
And the thing is, the epidemic, the money has not followed the epidemic. And I am hot, I'm sorry.
Oh, man.
And these are the number of adolescents, 13 to 19 years of age, reported to be living with HIV infection, not AIDS, in 2007. And so we have 76, 78, I can't see without my glasses, 78. And so you all can look at the numbers. Of course, New York has the most. And then this is the estimated number of adolescents 13 to 19 years of age living with HIV AIDS in 2007. So this is a combination of both HIV and AIDS. So we have 143. And this is just another look at it. Reported cases of HIV infection by age group, and so less than 13, and these are cumulative totals throughout the United States. So 5,821, less than 13, 13 to 14, 529, 15 to 24, 53, plus 1,000. And what's the age group that you all work with?
0 to 18.
Okay. And this just breaks it down by race. What we're looking at, the percentage of AIDS cases in population among adolescents, 13 to 19. And so you can look at the AIDS cases. This was in 2007. The number is 528 cases. 68% of those were African Americans. 19% were Hispanic, Latino, 11% white, and you can see the other percentages are pretty much less than 1%. But when you look at the population of the United States, 60% of the population is white, 15% is African American, 18 Latino, Hispanic Latino. So when you look at the epidemic, African Americans are disproportionately affected based on how many, what our percentage is. So 15% of the population, but 68% of the disease. And this is in adolescents. And it pretty much is like this for all age categories. And this is just a snapshot of the epidemic for African Americans. Well, I have 12%, but between 12 and 15%. And we are 45% of the cases. The age rate for African Americans is 7 times that of whites, and it is the 4th leading cause of death for men and 3rd for women, ages 25 to 44. And this is a snapshot of the Latino population. They are 19% of the cases. They're 3 times more likely than whites to be infected, and it was the 6th leading cause of death for men and women for ages 25 to 44. And then this is what's going on with the youth. Adults and teens between the ages of 13 and 29 accounted for 34% of all the cases. And girls, teen girls represented 39% of the AIDS cases among 13 to 19-year-olds. And black teens represented 69% of cases reported, and Latinos 19%. Are y'all tired of numbers yet?
Well, those numbers, one thing that hits me is that means that it's overwhelmingly heterosexual.
It depends. it depends, but yeah.
I mean, I'm getting that impression when I see particularly those young people
Right.
Stats, because
Although,
teen girls. That's-
although males who have sex with males, still it's the highest
yeah.
prevalence.
Mhm.
Those that are becoming infected, when we look at it year to year,
Mhm.
it's heterosexual contact. And then this is what's going on in South Carolina. 1,200 new cases between 2008, 2009. Currently 14,600 people living with HIV, including AIDS. We are 10th in the nation, so that's not good. We are also ranked 3rd in the country for proportion of people living with AIDS that are African American, which is 72%. And Columbia ranks 7th, Charleston ranks 20th, and Greenville ranks 55. And when you break it down by counties, Richland County is #1. I think Bamberg is #2, Sumter, and then Orangeburg. And so we talked about all those numbers. So now, what is HIV and what is AIDS? And so HIV is human immunodeficiency virus. It's a bloodborne virus. It infects CD4 cells and it gradually wears down the immune system. And CD4 cells is what is measured when we're looking at your immune system. And so the virus invades the CD4 cell, multiplies itself, and eventually breaks down the entire system. And that's why people have so many infections when they're HIV positive, because their body can't fight off any infection. And then what is AIDS? And it's acquired immunodeficiency syndrome, and it's advanced HIV disease. So individuals can be HIV positive but not have AIDS. And for some people that it bears a distinction. If I don't have AIDS, then I'm doing good in people's minds. And so we're careful to make the distinction with people who are HIV positive. And it's a severe immune dysfunction, and you're vulnerable to a lot of diseases. And there's a slide with all of the opportunistic infections on it, stuff we can't pronounce, but these are the types of diseases that occur in HIV positive patients when the immune system gets really vulnerable. And it takes about 10 years in untreated patients for them to go from an HIV status to an AIDS status. And I know that, well, I've been a nurse for a long time, but when all of this first started in the 80s, we were under the assumption that you would have to be tested for 10 years or it didn't show up in your body for 10 years. So I don't know how many of you think that, but that's not the case. And we'll also look at the course of the disease. And for clinical diagnosis, an AIDS diagnosis is given to a patient when their CD4 count is less than 200, or they have one to three of all of the diseases that are on another slide. Any questions?
I've been under the impression that HIV is becoming increasingly manageable in the sense that there's medication you can take to keep you from it going into AIDS.
Right.
And the example that I always, because I'm a sports fan,
Yeah.
is Magic Johnson. Because how long ago did he announce he was? that he
10
had
years at least,
HIV?
maybe
I think
15.
it's at least 15.
Okay, and he's hailing hard. I see him on TV all the time now. He's hailing hard.
Well, guess what? There are lots of people who look just like Magic Johnson, and you would not know their HIV status. So you definitely can't look at anybody and
Well-
tell whether or not.
Well, I know that.
Mhm.
What I'm getting at is that I know he's HIV,
Mhm.
and yet he looks
And-
great,
and
so I'm
he
thinking
could-
he's
he could have an
getting
AIDS
some
diagnosis.
treatment.
Right. The medicine, I'm trying to see, way in the 80s when the medicine first came out, people would take 30 pills a day. It was something really ridiculous.
Yeah.
And so now we've evolved to combination therapy, and we've even evolved to having 3 pills mixed into 1 pill. So instead of individuals having to take 3 pills 3 times a day, they're taking 1 pill once a day. So the pill burden has decreased
Yeah.
tremendously.
That's great.
And because of, I can't keep count of the number of drugs they have now, but more drugs have been developed and people are actually living longer. So HIV is not what's going to kill them. It's going to be diabetes, heart disease. It's going to be all of the things that other people die from, because these people will get old. They will grow. I mean, if you take your medicine, you will live and become old. So, and I'll just tell you all about a case. We have these cases that are presented, difficult cases, and there was a gentleman who kept presenting to the emergency room. He was a white male, I think in his either 70s or 80s, been married 50 years, but kept on having respiratory difficulty and progressively getting worse. And it took them a while, but eventually they tested him for HIV and he was positive. So it's just to show you, I guess Viagra, Cialis, and all, Levitra has something to do with all of that as well. But individuals are getting infected later in life. People are living longer. So we'll have a whole geriatric population of HIV positive individuals.
Well, now those people who have other problems like heart disease and diabetes and stuff, does HIV aggravate those situations, or it has no impact?
It can, and a lot of the medication, the medication, even though it works really well, is very harsh on the body. So some of the drugs actually cause diabetes. It causes the body to develop fat deposits, lipodystrophy. So your body looks a little bit funny. You might have a humpback and different things like that. So HIV, it doesn't help. It doesn't help, but in addition to managing the HIV, all of the other diseases can be managed as well. So how is HIV transmitted? And we talked about Magic Johnson, and when he was first diagnosed, none of his teammates or other players wanted to play against him. So for fear that they would,
Yeah, the perspiration
right.
issue.
So just to let you all know, HIV is not transmitted by kissing. It's not transmitted by hugging. It's not transmitted by playing sports and exchanging sweat. You can't get it from blood transfusions. So people think that if you give blood, you may get HIV.
And you know, and this was a very long time ago, in the early 80s, I can remember giving blood and having to sign a little waiver telling me there was that I understood there was this really small chance
Well,
that we have a problem.
Well, if you give blood, there shouldn't be any problem because
Right.
the instruments should be sterile that they're using. However, before they developed a test to check donated blood for HIV, there was a risk of becoming HIV infected from blood or the ash. I'm not sure.
There
what
was a
else
very famous athlete, another famous athlete, who got HIV, or became HIV positive, and eventually died.
Arthur Ashe.
Arthur Ashe,
Yeah, that's right.
from a blood transfusion.
I
Yeah,
remember
so,
reading that,
but
yeah.
virtually blood is, it's safe. All blood is tested, and so that risk is very small. You can't get HIV from mosquito bites. You can't get it from drinking or eating behind somebody. You can't even get it if somebody chews the food and you chew it behind them. You know, mothers do that with babies.
Mm.
So even that way, the risk is really, really small. You can't get it from toilet seats, shaking hands. Any other ways anybody think or thought or, so any casual contact, you cannot get HIV.
The people don't really understand all this.
Do they understand?
No, they don't understand.
No.
Because in my classes before I retired, I taught music, and the kids had recorders as a little flute, and they were made of some type of plastic type of thing. And I put each child's name on his recorder, and at the end of the year, I sterilized them in a special sterilization fluid that you use for wind instruments. And the principal told me I couldn't teach that class anymore. I said, why? She said, they'll catch AIDS.
Okay, and so we have a lot of misinformation, and I think because people are scared. People are still scared. So and so we do.
I ignored her.
So we talk about stigma because that plays a big part. Culture in cultural competency. It's like we could talk about HIV forever and ever and ever because there are so many issues associated with HIV, and so we're only going to touch a tip because we could talk about the economics of HIV. We can talk about why we think people become infected. So it becomes so complicated and so complex that we could talk about it forever.
What about those needles?
About
hypo needles? You get drugs? Can't you get AIDS from those?
Okay, this is my next. Oh, my slide is playing tricks on me. Oh, I missed a slide. Where's my slide? Okay, one of my slides got lost. No. Okay, well, HIV is spread by blood, semen, vaginal fluids, breast milk, and from mother to child, which we call vertical transmission, which has been pretty much, I know we looked at the numbers of the number of children that are positive, but overall, HIV has gotten down to 4%, a 4% positivity rate in pregnant women, because women can now take meds through their pregnancy, and then there's also a protocol that once the baby is born to an HIV-infected mother, the baby is given medication immediately after birth, and then also for 6 weeks after birth. And we have very, very few babies born in this state. I want to say one, maybe one last year or something like that were born HIV positive. So that has been a really big breakthrough with HIV.
So the medication can reverse in a newborn?
Not reverse.
Okay,
It prevents.
Okay.
It prevents. So as long if the mother is taking medication, seeking prenatal care, and the baby gets it's a whole protocol. And the baby gets the medication. We've had very few babies to convert their blood to convert to HIV positive.
How soon in the pregnancy would this medical intervention have to begin?
Generally at 3 months. And if women were already on medicines, it depends on which medications, because some medicines may cause birth defects or they don't know the effect. And so women are generally placed on AZT.
Can you repeat the list again?
I'm sorry.
Can you repeat the list?
It's blood. So if you share needles, it can be transmitted that way. If you have sex, and anal sex, vaginal, oral, and there's some exchange of blood or broken tissue, it can happen that way with blood. And then it's also vaginal fluid, semen, breast milk. And so this, we can talk about the natural course of HIV, and this is, this just shows what happens, and hopefully I can explain this enough for you all to understand. But the red line is the HIV RNA, which is the virus. So this shows the virus that's in the blood. And the black line shows your immune system and what happens. And so when you're infected, your viral load goes extremely high, and your CD4 count drops because it's trying to fight off the disease. Your body, anytime there's anything foreign in it, you're gonna have your immune system rush there and try to take care of it. So your immune system drops. And then
CD4 count, is that produced by the liver?
by the,
Liver?
no,
Okay.
so it's white blood cells.
Okay, all right.
White blood cells. And so then the immune system works to remove the virus from the blood, as I said, and then your CD4 count is still high because the body's doing good. And then we look at number 4, virus levels are reduced, but replication is constant. So if you're not on any kind of medicine, your body adjusts, but it's continuing to replicate in your body. And as it's doing that, it's damaging your systems, and you are susceptible to a lot of infections. And then we look at number 5, HIV levels increase as disease progresses, so your HIV viral load is going to go up, and your number 6, your CD4 count goes all the way down. And so this is what happens. One goes up, one goes down, trying to fight off diseases. And let me just go back to where number 1, when you're infected, if you're tested at that point, your HIV test will be negative because the body hasn't produced enough antibodies that will show up. So antibodies show up between 3 to 6 months after infection. So just keep in mind, if somebody had sex today and they went for an HIV test, it's going to show what they did 3 months prior to, not what they did today or yesterday. So you would need another test in 3 months. There's a window period. So if somebody is engaged in some risky behavior and they go and get tested, that test is going to show up negative. So the recommendation is always to be tested again in 3 months. We got that one? Because a lot of people get confused about that one. However, there are tests that can tell whether or not you have the virus immediately, but they're very expensive, and it's not generally the customary test.
So in other words, to know you're truly negative, you gotta have it done twice, 3 months apart.
Right. If you, well, the other thing is, okay, so I did something risky and I got tested. Well, from then on, I should use condoms. You should use some protective measure.
Yeah.
And then you'll know when you test in 3 months that it would have been anything that was unprotected back then, not anything moving forward. Am I making sense? Okay. Okay, and so this is what happens in those stages. And this is stage 1 that we just saw. It's the primary HIV infection. It lasts a few weeks. Individuals usually have flu-like illness symptoms, malaise, fever, weakness, sore throat, anything you would think you had the flu. You have large amounts of HIV in the blood that we talked about. The immune system begins to respond, which we call seroconversion, and an HIV antibody test done before seroconversion is complete may not be positive. And this is stage 2. It lasts for an average of 10 years. We have no major symptoms, HIV viral load drops to a lower level, antibody tests will be positive, and the virus, as I said, is not dormant. And during this time, just think, we said 21% of people don't know they're positive. So they could have, for 10 years, just been going on with their life. I mean, if you're not married, and you could have had numerous relationships. So you can just imagine the number of people that can become positive when others don't know their status, and you feel well for 10 plus years. And generally people find out, if you're not a person who has been tested, they find out when they get really, really sick. And it's usually some type of respiratory infection. And then stage 3, the immune system is damaged. Your lymph nodes become non-functioning, so people have swollen lymph nodes. The body fails to keep up. The immune system fails. And then stage 4 is AIDS, and it's confirmed if a person develops one or more of a specific number of severe infections or cancers. And when we look at labs, if your CD4 count is less than 200, then you automatically get an HIV diagnosis. Even if you start taking medicine and your CD4 count goes up to 201, you still are considered to have an AIDS diagnosis. And again, AIDS never goes away. So let me just talk about this. And these are some of the diseases that individuals will present with if they have not had any treatment. And we can barely pronounce a whole lot of them. So this is just so you all can get an idea. And
Go back to that one again.
mm-hmm.
There's something up there resembles a word that I heard
Which
recently.
one?
It's an intestinal cryptosporidiosis, something.
Oh, chronic intestinal greater than 1 month. Are you thinking about, it just slipped my mind.
It starts off with crypto, and it's intestinal. Some kids caught it at the water park in Orangeburg. 12 kids came down with it, and they said it was a bacteria. It closed the park down.
This was the splash thing.
Yeah. Mm-hmm.
Yeah.
And I'm drawing a blank, and I know what you're talking about.
I can't even remember,
My-
but
my
I know it
brain
started
not
off with
functioning.
crypto.
And generally, a lot of these things are present in the environment every day, and some things are in our bodies, but because our immune system is functioning properly, nothing happens. But for people whose immune system is not functioning properly, these things are not good. And so here are more. And then we also, that CD4 count that I was talking about, when it's less than 200, antibiotics are also given to prevent a lot of these infections. So that's one reason why it's good to be in care as well. So that even if you're not on HIV medicines, they can put you on antibiotics, which are very, very cheap, and it will prevent you from getting a lot of these things. And these are the CDC recommendations for testing that I spoke of earlier. And and this is because, again, those people don't know that they're positive. And so the objective of this initiative is to increase HIV screenings of patients, foster early detection of HIV infection, identify and counsel patients with unrecognized HIV infection, and further reduce perinatal transmission, that's mother to child.
You see the people insisting on this HIV testing in the maybe clinics or the places where the poor people go, where they go to the doctor. Plenty of things HIV testing. And then you go in one of the regular places, regular clinics where, you know, folks who have some insurance and stuff, you don't see that.
Okay.
But you know they can have it too.
You are absolutely right. We are on the same page. Nobody listens to me because, and so what this initiative is supposed to do, it's supposed to help what they call routinized testing, so that, let me just show you, well, it's one of the slides, but the recommendation is that everybody between the ages of 13 and 64, which everybody's not sure about cutting it off at 64, because I just told you all about the gentleman that was either in the 70s or 80s that was positive. But everybody who presents, and it doesn't matter what you're presenting for. If you say my little toe hurts, then the recommendation is that you are also offered an HIV test. And so we do know that that happens. Well, HIV testing doesn't happen in private doctor's offices or private clinics because it's the assumption that these people are not at risk. But anybody who's having sex is at risk. So whether you are married or not, so whether you're married or not, because you're only responsible for yourself. You have no, you may not have an idea of what your partner is doing.
They told us in New Jersey, when I was teaching in New Jersey, all about the problems of kids getting a hold of drugs. They were talking to the people who taught the kids in the inner city. In the suburbs, South Orange, West Orange, Dover, nobody was looking at that. Those kids were running all over the place.
Right,
Drugs,
and that's usually,
needles, you name it.
those are usually the kids who are doing the most drugs.
They had the money. They could buy them. And nobody ever thought about them. I don't know what it's like now, but I'm going to tell you that was really a big oversight.
And that's why when I said stigma, and people only think that it happens to other people, not me, not in my backyard, not at my church, not in my family. So we have to get over that and look at this as a medical condition and not look at, I guess, the moral issue, if people have moral issues behind HIV. So, yeah, but we're missing a whole lot of individuals because of assumptions that we make, that particular people are not at risk. And so this was their rationale for coming up with this initiative. And then these are guidelines from the CDC. So, and HIV can be detected by reliable, inexpensive, and non-invasive screening tests. So either your mouth can be swabbed, finger stick, and let's see, the cost of screenings are reasonable in relation to the anticipated benefits. And so we want to decrease the number of missed opportunities, destigmatize the testing process, link clinical care with prevention, and ensure immediate access to clinical care. And so this is everybody who should be tested. Anybody that's 13 to 64, anybody that is being treated for TB, and anybody seeking treatment for STDs. What time is it? I see everybody packing up.
Well, she had to leave the.
Okay.
She got about 10 minutes.
Okay, and so any questions about testing the disease or any
How
questions?
does it affect the child? I guess that would be our concern too, though. You know, some of our parents have it. The daily life of the child, we can get the father say from blood transfusion or born tested positive. How does that affect that child's quality of life?
Say it again.
I'm just kind of get a view of what would a child's life when somebody said tested positive at birth. for HIV.
If they're positive at birth, if they are in care, they will grow up to be healthy. The kids that were born positive years ago are now young adults and teenagers.
Okay.
So as long as they're taking their medicine, they're just like anybody else. And so that's another thing. Just for instance, my daughter, I'm always talking, she's 13, and so I'm always talking about HIV sex. And her comment to me was, so I can't get HIV if it's both our first time. And so I had thought about that, and then I started thinking, and I said, well, it could very well be your first time, but kids who are born HIV positive could have never had sex, and so you have to consider that, and that's just not something that people are going to disclose. So you still have to be careful, even though it's both your first time.
Well, I noticed that there was something about some federal issues being contested. No, some issues being contested along federal guidelines in the prisons here.
Mm-hmm.
And they were putting the HIV people in special dorms. Now that makes sense to me because prisoners fight so much, it has to be some blood exchange.
It's not about fighting, it's about sex.
Yeah, it's sex too, but they do that too.
It's about sex. So
they think that that doesn't happen because they are in supervised areas, but it does.
That's what everybody's talking about now. South Carolina is, I think, the last state, or I think Mississippi and Alabama may have disbanded how they do things, but South Carolina is the only state that separates. They don't want to use the word segregate. They separate inmates, HIV positive inmates, from the general population.
That makes sense to me.
And so now they're being sued because somebody thinks that it's a violation of their rights, and they should be in general population. And of course, as a medical professional, and the people that I work with, we see it a little bit differently because we know that these individuals get really good medical care. They get their medications, and so it works from that standpoint. But they are not allowed to participate in different programs that other inmates are allowed to participate in. So that may be a reason. If there's something that you could do to work time, good behavior, or work time off your sentence or whatever, they're not allowed to participate in those programs.
They didn't mention that part.
Well, so it could go either way. It's good and it's bad. So, and anybody who I also manage, I'm director of an HIV testing program at Alvin S. Glenn Detention Center, and so anybody who tests positive and have a sentence over 90 days, they automatically, even if it's something minor, they have to go to Broad River. So all HIV positive inmates in the state.
Oh, the HIV people go to Broad River.
From any state prison, if you're positive, you go to Broad River.
Oh, okay. And Alvin Glenn
is the only jail out of all the 64 counties that has an HIV testing program. It's a demonstration project,
Oh.
just to see how testing would work in a jail setting, because that's not something that's customarily done. And I just wanted to give you all some information, I know we're running out of time, on some of the programs that are available to individuals who are HIV positive. And the program is Ryan White. So if you all ever hear the term Ryan White, it generally refers to an HIV-funded program. And do you all remember Ryan White?
Mhm.
Oh, okay, so it's named for Ryan White, and it's administered by HRSA, and it's the resource of last resort. So if you have insurance, then you wouldn't receive Ryan White assistance. And I don't know, another thing that's been in the news has been the AIDS drug assistance program that's run by DHEC. I'm not sure if you all heard anything about that, but that's a program that's funded through Ryan White, and they've run out of money, and so individuals aren't able to get their medication, and they're on a waiting list. And this has happened before, and individuals died the last time waiting to get on the medication list. And in South Carolina, we have parts B, C, and D. Bigger metropolitan cities have much more money because they have Part A, so we don't have that here. And this funding is in all 50 states, and DHEC is actually the entity that gets the funding, and DHEC filters it down to other individuals, well, other agencies. So I'll just skip that. And I've talked about the AIDS drug assistance program. And there are 11 service providers in the state. And this is where they are. Aid, Upstate, Piedmont Care, Catawba Care, Hope Health, USC, where I'm from, Upper Savannah, Hope Health, MUSC, Access and Care Team. So there's somebody covering every region of the state. And these are just some of the services that are that Ryan White patients are eligible for. And I won't read all of them, but these are the core services that they are required to get. And then we have support services. And not everything is funded. It just depends on how much money the feds give DHEC and what they consider a priority. And then we also have Part C funding. And these are medical clinics throughout the state, and there are 10, and they're in community health centers. So Richland Primary Health Care, and are you all familiar with Richland? It's on Laurel Street. They have several locations, but in addition to the clinic at the university.
It used to be called Richland Family Service or something like that.
It could have been. I'm not from here, so so I don't know. But Richland Primary Healthcare Association, that's what it's called, something like that. But that's the other clinic that's in this area. And this is where these are all of the other providers. So in Beaufort, Jasper, all of these places have numerous clinics, and I've traveled all over the state and I get confused, so I don't want to tell y'all where they are. And then there's also money for women, infants, and children. And so there's a pediatric HIV, infectious disease provider here in Columbia. And that's it. Any questions? I hope I didn't bore y'all.
Is there ever
No,
it's very informative.
misdiagnosed of this?
Has anybody been misdiagnosed? Mm-hmm. Well, generally it was with a rapid test, and it could have been with blood as well, but some things may cause what we call false positives. And I can't remember what causes false positives right now, but there have been some instances or indeterminate, where they can't figure out whether or not a person, is infected or not. And those people, indeterminates are usually retested, but there have been some false positives. Any other questions? No?
Ms. Harrison?
Anybody else get HIV besides humans?
Yeah, the origin of HIV goes back, I think they say about 100 years, and it was actually a virus that was in a chimpanzee, and that jumped over to humans because in Africa, I guess either they ate the chimpanzee meat or however the blood somehow infected chimpanzee blood got into humans. So
If HIV disease, if HIV is detected early, what percentage-wise, what are the chances of not getting AIDS if properly treated?
you can go a very long time. We have people who've been positive for 30 years,
Really?
so 20 plus years.
So
And
there's
it's a possibility they weren't caught early. It's just that the medication works really well now for them. And if you, of course, if it's caught early, then you have a regular lifespan.